This patient presents with a wound on the plantar surface of his left foot, specifically on the distal medial aspect of the ball of his foot. The wound dimensions are 2.2 centimeters in length by 5.7 centimeters in breadth and 3 centimeters deep. There is a 2 centimeter tunnel at the 12 and 6 o'clock positions. This wound looks fairly dry, except for the top right picture. That picture shows minimal drainage. There is sign of infection as the wound has a pink-yellow appearance along with slough in the wound bed. There's also a sign of inflammation as the foot up to the ankle is red and swollen. The wound on the bottom of the foot has an oblong, lacerated appearance. It also kind of looks like the results of a popped blister. I can't decide. The peri-wound is smooth, defined, and calloused, signifying that this is a chronic wound. Likely etiology. Well, diabetes can lead to many secondary complications. It's common to see wounds on the medial-lateral forefoot in patients with diabetes. Frequently seen causes include bunion deformity, narrow width shoes, and edema blisters, but improper footwear is the most common cause of injury. It is also common to see diabetic-related neuropathy in patients with hyperglycemia. With this patient presenting with uncontrolled hyperglycemia, there's a high chance that he has diabetic-related neuropathy, which would decrease his sensation in his foot, and that could explain how this wound has a larger diameter and a chronic presentation. So it's likely that this patient was able to feel like improper footwear or possible trauma that had occurred earlier on, and it could be due to his neuropathy. So I would make sure to test for that. I think this wound is chronic. It doesn't have a freshly opened presentation, as the wound is fairly dry, with none to minimal drainage along with the peri-wound being thick and calloused. This wound looks like it has been open for a while and is not in a place that would allow for closure in a timely manner, with it being on the bottom of his foot and it's pretty wide. It does not present to be in a healed state, as there's slough in the wound bed and no signs of granulation tissue. At this point, the cells look inflamed and are infected. There are many barriers that could affect the healing time of this wound, the first being location. The patient will need a way to prevent compression and direct pressure to the wound site. With it being on the bottom of the foot, it is important to find proper footwear or to avoid weight bearing on the ball of the foot. Avoiding walking altogether and continuing his sedentary lifestyle would delay healing though, so we want to figure out a way to allow him to be up and mobile while still protecting the wound site, and that way it would encourage adequate blood flow and circulation. The patient's uncontrolled hyperglycemia can also lead to, or we talked about it earlier, how it could lead to neuropathy, or it could also increase intracellular glucose and sorbitol levels. But that could lead to oxidative stress and cardiovascular disease. Cardiovascular disease could decrease perfusion and affect circulation, which would delay healing too. Also, a lack of proper nutrition. He has a poor diet. That could increase the risk of complications and delay healing. So I'd make it a priority to educate or remind the patient about the importance of having a more regulated diet. I would also stress to the patient that compliance to wound care is imperative to healing time. He has struggles to comply with his diet and diabetic care, so I would educate him on the importance of performing daily foot checks and just following his wound care instructions and keeping up on it. That way it would encourage proper and quicker healing. Agents I would use, I would first apply saline to the wound and forceps before debriding the slough I could from the wound site. I would also remove any excessive callus that would be affecting the wound. Then I would follow physician instruction of using the Dakin solution to further clean the wound, and then I would cover it in the betadine soaked dressing. Both those solutions are used to prevent and treat infection, and it's indicated in this patient's case because his wound showed signs of infection. I would avoid compression, but instruct the patient to elevate his foot several times throughout the day to help reduce swelling as much as he can. I would cover the betadine dressing and a wound seal to help keep out infection and encourage a more moist environment. We don't want it to become, it is already dehydrated, so we want to get moisture in there. That way it will enhance angiogenesis and collagen synthesis, as well as encourage the breakdown of the dead tissue that's in there.